No matter what kind of surgery you had for breast cancer, certain stretching exercises can help decrease pain and improve shoulder motion quicker. If you had radiation, then these stretches and strengthening are even more important. My name is Kelly. I'm an oncology physical therapist and lymphedema therapist. And in this video, I'm going to share with you my 3 go-to stretches to improve shoulder motion after breast cancer surgery or radiation. Before we begin, make sure that you subscribe down below for weekly new videos. You can also join us on Instagram for more related content on breast cancer recovery, and you can check out my website for more resources. So I'm going to go through and show a few beginner stretches, but if you like to learn these techniques and go more in depth for arm mobility after surgery, then you'll definitely want to check out my breast cancer rehab program. For years, I saw how little guidance and support there was, so I'm bringing this all to you. I have a full program that guides you through all aspects of recovery and rehab, from lowering your risk of getting lymphedema to getting your shoulder motion back in full, reducing pain after treatment, and more. And I specifically have a section that I go in depth on how to improve arm range of motion and strength. I share these exercises and hands-on techniques in detail in the same way that I teach my patients in the clinic. You can get access to the entire program with dozens of exercises, or you can just choose the topics within the rehab program that you personally need help with. So for more information, head over to my website, which I'll link directly down below as well as up above. But otherwise, let's get started. Once cleared by your doctor after surgery, then we start with light stretches that focus on the pec muscles across the chest. These are the large ones that go right across the chest, and they easily get irritated and inflamed by the surgery. If someone also had reconstruction, depending on if it's on top or underneath this muscle, that can also be a large factor. Stretches should be light and felt mildly, not intense and not a lot of strain. But let's show each stretch one by one. So to do this first stretch, we'll be laying on our back. We can put our hands behind our head, elbows pointing towards the ceiling. We're going to allow our elbows to gently fall open to the sides so we feel a mild to moderate stretch across the chest. This is going to vary person to person, but we want to make sure that we keep it nice and mild. From there, some people might just want to hold here because that's enough of a stretch for them. And then for someone who's looking for more stretch, what we want to do is add in the rotation with the twist at the lower body. So taking our knees that are bent up and letting our knees fall over one way, and that'll get a nice stronger stretch across the opposite side. Holding that as needed, and then back, and then the other direction will get the other side. So that might vary person to person. I like going back and forth to compare. But when you get to that stretch, I like to add a deep breath. Take a nice big deep breath into that tight area of the chest. And as you let your breath go, let yourself sink further into the stretch. Hold for 5 or 10 seconds. And then after that, we would gently come back to the middle, and you can either do the other side or repeat on that simple tight side. So to show one more time, legs fall over, feel a nice mild to moderate stretch across the chest. Take a nice big deep breath into that area. And as you let your breath go, let yourself sink into the stretch. Holding there, and then repeating 2 or 3 times on the side as needed, and that can be done once or twice a day. This stretch is a great place to start to ease into improving the motion of the pec muscles and the chest area. Once someone does well with this without pain, then we can move on to the next stretch to work towards full shoulder range of motion. For this stretch, we're going to be raising the head to help improve that motion. So you can hold onto a PVC pipe, a broomstick, golf club, something to hold onto as you'd like. The legs can be straight or bent, whatever's comfortable for someone's back. Or you don't have to hold anything, but I like to think thumbs up towards the ceiling to start. From there, we can raise our arms up overhead till we feel a nice mild to moderate stretch that we can tolerate, and then coming back down. We want to make sure as we go up, we don't let ourselves arch into our backs to compensate. We keep our backs nice and flat, core engaged, and you're just going as far as your shoulders will let you, all the way up, and then all the way down. If someone has any pinching in the shoulder, We don't want to go that far. We might have to continue to work on strengthening the middle back muscles if that's the case, which I have other videos on my channel for, as well as in the program on how to do that. But keeping everything nice and mild, starting to work on getting some of that range of motion back. So getting where you are, maybe taking a nice big breath. As you let your breath go, let yourself relax into that stretch. Hold for a few seconds, and then coming back down. But doing 5, 10, up to 15 at a time. Doing a couple sets of those, once or twice a day is plenty. A good way to start to get range of motion back. Lastly, someone may be able to move on to a stretch for the lat muscles, which are the sides of the chest or on the side of the chest into the back, and they are often affected with surgery as well and can limit someone from raising his or her arm above their head to bathe or to get something out of a cupboard. So with a stretch for that lat area, that tightness on the side, what we want to do to help improve the motion is either at a doorway or a door or a wall, as we're going to be doing wall slides or doorway slides. So I like to stand at a wall. Some people can start arms width away, starting close as needed, and we're going to gently slide our hand up the door or up the wall till we feel that mild to moderate stretch on that side of the body. Take a nice big deep breath into that area that's tight. And as you let your breath go, let yourself drop further into that stretch. Maybe able to go a couple more inches, hold for a few seconds, and then gently come back down. And repeat again, so sliding up till we feel that mild to moderate stretch. Making sure we're not arching into our backs. We're compensating with our low body, core is engaged, just feeling the stretch on the side. Breath in and breath out. And then down. And that can be repeated 3 to 5 times, 1 to 2 times throughout the day. And those are my favorite beginner exercises for improving range of motion after breast cancer surgery or radiation. For progressions and dozens of other stretching and strengthening exercises, along with manual or massage-like techniques, be sure to check out the link in the description box down below for my breast cancer rehab program, or just head over to my website at 𝐭𝐡𝐴ncerrehabpt.com. Other than that, I hope you all found this video helpful, and we'll see you all in the next video. Thanks, everyone.